them as well. So today, this isn't a topic that's in the news right now, but it's a lot of confusion that we get with patients whenever I talk about IUI or IVF. And these are the alphabet soup terms with our field. IUI stands for intrauterine insemination. That's where we have a little tiny catheter that passes sperm through a woman's cervix into the uterine cavity as a method to improve fertility. IVF, or in vitro fertilization, removes eggs from a woman's ovaries, and then insemination occurs for fertilization in the laboratory, and then we transfer an embryo back inside the woman's uterus. So those two are pretty distinct treatment options for patients, and there's advantages and disadvantages. So let's start with IUI. This is often termed artificial insemination. So there are many reasons why a woman or a couple would want to choose IUI cycles. And we typically mean, when we mention IUI cycles, it's fertility medication with IUI cycles. Now, do we ever use IUI without fertility medication? Yes. A very easy example would be donor sperm. That's a single woman, same-sex couple, or a heterosexual couple. If the man doesn't have sperm, we can just obtain sperm from a donor bank and then gently pass that into the uterine cavity with IUI when a woman's ovulating. When we talk about IUI cycles for fertility treatment, that's when we give the woman medication to increase the number of eggs that she normally ovulates. I'm going to back up for just 1 second. Now, there are two different ways we could use fertility medication. One of them is to get a woman to ovulate when she's not, and there the goal is to produce 1, maybe 2 follicle cysts with an egg, and we'll call them follicles. The other way that we use the fertility medication is to use that for increasing the number of eggs that a woman ovulates each month. Typically, they make 1 egg that ovulates each month. Medication will be used to increase the odds. Certainly, the risk of multiple births we are conscious of, and we do everything to try to reduce that, but intrinsic in the treatment cycles is to increase the number of eggs, okay? So when we monitor these patients on the medications, they'll either ovulate naturally or with medication to give a trigger shot to mature and release the eggs from the follicles. Then we time IUI. That's done about 24 to 36 hours after the trigger injection, usually with a hormone called HCG. IUI is where the man or the sperm are thawed, or the man produces sperm that morning. The sperm are washed in a special gradient or a special media in the reproductive laboratory and concentrated in a very, very small volume of the sperm in the liquid. We count as a total motility to see how much sperm is in that liquid. I would say we're talking about 0.05 cc's of volume, very, very small volume. And we look at the total numbers of sperm that are after the wash, and typically we like to see at least 5 to 10 million. The insemination is usually very, very simple, and if the partner is in the room, I usually have them press the plunger and put the sperm inside the uterine cavity. Patient does not have to rest. As a matter of fact, a recent article showed that there's no advantage to resting right after IUI. Success with IUI is based on a woman's age, about 10 to 20% on a monthly basis, and typically if she's ovulating, you'll go about 3 months, where after that you'll start seeing a diminishing return after those, and we look into doing in vitro fertilization. If you don't ovulate, we'll go up to maybe 4 to 6 cycles. IVF. Certainly a lot of information on our website about IVF, and here's where we're giving a woman typically injectable stimulating medication to produce now multiple follicles with eggs. After about 10 days of daily injection that involves ultrasound monitoring and blood work, then we perform a procedure about 36 hours after that trigger injection again, but this time we don't want the eggs to be released inside your body. We go in under ultrasound guidance, that we give the woman sedation with our anesthesiologist in our surgery center here. And with ultrasound guidance, a little tiny needle goes in the back of the vagina into the ovary, and we vacuum out the eggs. It takes about 15, 20 minutes. Patient is home within an hour or so. We add the sperm to the eggs in the laboratory and let embryos form and develop, and then we transfer the embryo back inside usually about 5 days later, sometimes sooner based on certain circumstances. IVF, much higher pregnancy rate based on age compared to IUI, certainly more costly, but lots of advantages with IVF over IUI. Extra embryos to freeze, you could do potential chromosome testing. So there's a lot of need for consultation to discuss those two different options of IUI versus IVF. I hope this was helpful, and please send us your comments, and we'll see you next week.